There is an age requirement. The donor has to be older than 18 and able to consent for themselves. They should be free of any active medical disease. The patients that are diabetic are excluded. Patients that have ongoing recurrent infections are excluded. Patients that had bleeding or clotting issues are excluded. Patients that had prior malignancies or cancers that are not in full remission for quite some time are also excluded. There are some relative contraindication for the donation. The absolute ones are what I just said, the hypertension, the diabetes, and the ongoing medical issues that are cancers and infection. The relative ones are if patients have only one single donor and it's a spouse that is over 50 with a minor hypertension and on one medication and stable, that's only a relative. We evaluate the patient. It's not a total full exclusion. A patient that have a family history of diabetes are not necessarily excluded. We look at their risk factors and we do a little more, another step to try to determine the risk for diabetes. But if that is confirmed, obviously they are taken out of the equation. If the donor has a family history of diabetes, they go through a glucose challenge to see what their response is. And if the response is normal, that means that at least at that given time, they're not diabetic and the risk for diabetes is minimal. Now, can they develop diabetes later in their age? Maybe, but that does not exclude them.